Hello friends, welcome to Curious Medic. In this series, we will be completing complete orthopedics. So, in this session, we will see about the basic of orthopedics and the basics of bone biology. If you want to truly understand the orthopedics, whether it is fracture or bone tumors or any other metabolic bone diseases or infections, you should see this video till the end because all these things are mainly dependent on the basics of bone. So, with that, let's start our discussion on the basics of bone. So, today in this video, in basics, we will be covering about the types of protein and cells present in the bone and also the anatomy and vascular supply of the bone. So, without delay, let's start the session. The bone is made up of mainly three components. One is mineral, the second one is water, and the third one is protein. The bone is also called as osteon. This the bone is also called as osteon. In the mineral component, we see the calcium phosphate as the hydroxyapatite form, and this calcium is the most abundant mineral in our bone. In the protein, we see the type 1 collagen protein mainly, and the third one is water, which is more in children compared to adults. And come to the protein is also called as the osteoid. Osteoid means the organic protein part of the bone, and the whole bone is called as osteon. So the osteon is equal to osteoid plus minerals, and it also contains some small cellular fractions and also contains the osteocalcin and osteonectin. And next we see the collagen types. In the bone we see the mainly type 1 collagen, and we also see the type 1 collagen in the tendons. The type 2 collagen is mainly abundant in hyaline cartilage, which is the articular cartilage of the bone, which we can see on the surface of bone near the joint. And next come to the types of cells present in the bone. When we talk about the types of cells present in the bone, there are mainly three types of cells: osteoblast, osteoclast, and osteocyte. The osteoblast is the builder of the bone, which forms the bone, which synthesis the bone. We can remember this as osteoblast. B means the builder of bone, and the osteoclast, which break down the bone, which resorbs the bone, and helps in remodeling of the bone. This osteoclast is a large multinucleated giant cell. This is formed from the monocyte, the fusion of the monocytes, the aggregation of monocytes, and so it is multinucleated. And next come to the osteocyte. The osteocyte is expired osteoblast, means the osteoblast mature and become osteocyte. That means the mature resting osteoblasts. These don't have any functions like osteoblast or osteoblast. These are only retired osteoblast, and these are the most in number in bone cells and the longest lifespan. And the osteoclast have the shortest lifespan. And there are some of the MCQ we can make out of this slide. And we need to learn about the Wolff's law. What is Wolff's law? Wolff's law is mainly suggests that the bone is the dynamic tissue. The constantly formation and resorption of the bone is continuously taking place in our body. It's not like the static. The bone formed by osteoblast and osteoclast removes the bone, and this is called as bone remodeling. This is driven by both osteoblast and osteoclast in balance. If the osteoblast become dominant, then the bone density will be more. We can see the increased number of osteoblast in the athletes or weight bearing individuals who usually go to gym. And the osteoclast is mainly dominant in hemiplegic patients or in immobilized patient who don't use the specific part of their body. So the bone is like formed on demand. Whenever there will be the requirement of the strong bone, the osteoblast become active and produces the dense bone. Whenever we stop putting pressure on the bone, then the bone density will be decreases. And what the Wolff's law says that bone adapts its structure through to the mechanical loads placed on it. The imbalance between the osteoblast and osteoclast, we say it as osteoporosis. And when we talk about the osteoblast and osteoclast, we need to remember the enzymes released by them when they are active. We can see in the fractured patient, the osteoblast will be very active and trying to synthesis the bone. In that condition, the osteoblast releases the ALB enzyme, which is alkaline phosphatase enzyme, which is osteoclast also produces the enzyme, which is we don't test for that usually. That is trap enzyme, tartarate resistant acid phosphatase, and also the osteoclast produces carbonic anhydrase. And we use these enzymes as the bone markers. The alkaline phosphatase is most important among all these. Let's talk about the layers of bone. The bone has mainly two layers. One is periosteum and one is endosteum. The periosteum means the outer covering of the bone, and the endosteum covers the inner covering of the bone. And every bone is covered by membrane called periosteum on the outside and lined innerly by endosteum. The periosteum itself has two layers. The outer fibrous, which is dense connective tissue, provides structural support, and the outer fibrous and inner cellular layer contains osteoprogenitor cells and osteoblast, which helps in the growth of the bone in the thickness of the bone, which helps for bone to grow in its thickness. And the endosteum is a single cell layer thick lining in the inner surface. Also contain osteoblast and osteoclast. And we see the most famous system in the bone known as the Haversian system. In the Haversian system, we can see the Haversian canal in the central, through which the blood vessels and nerves run longitudinally along it, and the concentric lamellae, a ring of mineralized bone surrounding the canal. That is the concentric lamellae, and the lacunae, cavities housing the osteocytes. The osteocytes present in this lacunae. These are connected via canaliculi. The- And also there is another term that is Wolfman's canal, which runs transversely connecting the adjacent Haversian canal. And let's talk about the blood supply blood supply to bone. There is one main artery called as nutrient artery, which goes inside the nutrient foramen and supplies the medullary cavity and the diaphysis. And there are also other vessels, some of which supplies to the outer cortex of the bone. These are called as periosteal vessels. And also epiphyseal and metaphyseal vessels. They supplies to the end of the bones. And the blood flow in long bone is centrifugal. That means the nutrient artery enters through the nutrient foramen around the metaphysis, and it's travel up, and the metaphysis has the richest blood supply, but the richest blood supply which is not so fast, and it is a sluggish and sinusoidal circulation. It is perfect for bacterial trap and the hotspot for hematogenous osteomyelitis. When the bacteria enters through our bloodstream, it will thrive there because it has very rich blood supply and there are no any inner lining of phagocytic cells. We can see here the blood enters through bloodstream and travels to metaphysis, and the hairpin loop in the blood vessels slow down the blood flow, and there will be no phagocytic cells there. Therefore, the bacteria will multiply there. And the most common site of osteomyelitis in the children is metaphysis. The hairpin loop architecture. This is an potential MCQ question. The terminal capillary makes the U-shaped turn before turning into venous sinusoids. The artery goes and makes the U-shaped turn and drains into the veins, venous sinusoids. This this creates the slow moving blood flow at the hairpin turn. So no macrophages like the lining cells in these sinusoids. So there is no any phagocytic activity. So there are no So due to lack of phagocytic activity, it is more prone for infections. Let's talk about the different types of bone. There are first we divide bone into woven and lamellar. The woven bone is the immature bone, and the collagen in woven bone is randomly organized, and it is weaker in strength. And we can see the woven bone in fetus and the fracture calculus. Fracture calculus means when the bone starts forming after the fracture, and the bone tumors also predominantly produces the woven bone. When coming to lamellar bone, as it is the woven bone is immature and the lamellar bone is mature, and the lamellar bone is organized and has the parallel layers, and the lamellar bone is stronger compared to woven bone. Let's talk about the difference between cortical and cancellous bone. The cortical bone is very dense bone and tightly packed bone, and which is present predominantly in the diaphysis, which is shaft of the bone, and it has lower vascularity because it is a very dense bone. Then, of course, there will be less blood vessels, so the vascularity will be low, and the healing will be slower because of lower vascularity. The healing speed will be slower, and there will be no risk of infection because there is no much blood supply. The infection, the bacteria tries to grow where there is abundant blood supply. So when we come to calculus bone, well, it is the porous, and we see this mainly in epiphysis and metaphysis. And here we have the higher vascularity compared to the cortical bone. So the healing will be faster, and also the risk of infection will be faster. And another one thing to notice is whenever there will be fracture, the cortical bone may go non-union, but the cancellous bone won't go non-union. It may go malunion. It will heal, but it will heal improperly. But the cortical bone may not heal. It is called as non-union. The fracture outcomes in the cortical bone is non-union, and the cancellous bone is non-union. And obviously, in the fracture is in the epiphyseal or intra-articular fracture, there will be highly reduced movement. The disrupted articular surface damages the joint. The cancellous bone heals fast, more cells, vascularity, surface area, but same vascularity, higher risk of infection. When we see about the normal anatomy of the bone, there will be epiphysis, metaphysis, diaphysis, and next again metaphysis and epiphysis, and there will be the growth plate in between epiphysis and metaphysis, which we called as the physis, which is only seen in children because after maturity this epiphyseal plate will be closes. Not after. This epiphyseal plate will close as the children grow, and this epiphyseal plate helps the bone to grow longitudinal. And this when we see this growth plate in the X-ray, we see the radiolucent. There will be no mineral deposition. I will we will see when the mineral deposition will happen in the bone. And coming to metaphysis is highly vascular and rich in blood supply in the long bone. The most vascular area of the bone is metaphysis, and the diaphysis is the shaft of the bone, predominantly in cortical bone. And coming to the layers of growth plate, the growth occurs from epiphysis to metaphysis. We call this as the direction of growth. When we see about the layers of the growth plate, we see that the first layer is germinal layer, which contains stem cells, and the most important layer. And as we come near to metaphysis from the epiphysis, we see from germinal layer, next is proliferative, hypertrophic, zone of calcification, and the zone of ossification. And the germinal layer contains the stem cells, and in proliferative layer, the cell divide rapidly and multiply in number. In the hypertrophic layer, the cell enlarges to accommodate the calcium inside it. And the zone of calcification, the enlarged bone get calcified. Hypertrophied cell undergo calcification in this zone. And the calcified cell integrate into the bone matrix in the zone of ossification. And In this session, we talked about the two types of bone growth. One is longitudinal and one is radial, or the growth in width. The longitudinal growth is caused by the growth plate and also called as interstitial growth of the bone. And the width of and the growth in the width of the bone is called as the oppositional growth. And these are the quick reason of MCQs which may appear in our exams from this video. Let's wrap up this session here. And if you followed this video up to the end, then please like this video and drop your any questions in the comment box, and I will try my best to answer all of them.